You know, every time you feel slightly under the weather, the worry over whether you have COVID-19 may instantly arise. It can be hard to tell the difference between symptoms of the coronavirus, the flu, the cold. Dr. Brent Wallis with People's Health joins us this morning to kind of help distinguish that. Good morning, Doc.
Good morning, John.
Let's talk, if we could, first about the flu, because that's obviously the more serious situation. I mean, is there any way to tell whether you, from a layman's standpoint, have the flu or have COVID-19?
Yeah, it's real difficult because there's a lot of symptoms that they have in common. Both can have cough and fever, body aches, and sort of fatigue. Really one of the key indicators for coronavirus that we've determined over the last several months is shortness of breath is one symptom that you really need to watch for, and then loss of taste and smell is a real strong indicator for COVID-19.
Some people who had it said they lost their taste and their smell one before the other, and that's the only thing they really ever felt in some cases.
Yeah, sometimes that's what we see is actually your only symptom is that. So that's a good indicator that maybe you need to go get tested or talk to your physician.
All right, so, you know, the common cold is a coronavirus, so how are you supposed to be able to tell whether you've got, just the cold or this more serious virus?
Yeah, it's very true. This time of year is when we start seeing all of the common colds come into the area. Typically, though, those are upper respiratory infections as opposed to lower respiratory, so they tend to affect the nose more. You can get congestion or runny nose. They don't tend to affect the lungs, which is what causes that shortness of breath you can see with coronavirus.
Interesting. So when do you go to the doctor?
Most of the symptoms are pretty mild for all of these, flu, COVID-19, and the cold. But if you think you may have the flu or COVID-19 in particular, or you have high fevers or shortness of breath, you should talk to your doctor. And it's probably best to give them a call first because we're trying not to spread the COVID-19 virus around. So they may direct you to a testing site that can help you tell which one it is.
So, I mean, this is a virus, not bacteria. So what does that mean when it comes to antibiotics, which people might have thought of in the beginning of this?
Yeah, a lot of people think antibiotics may help, but they won't. And, for the flu in particular, if given very early in the disease, we do have some oral therapies that you can try. We are starting to get some therapeutics for COVID-19, but all of those have to be administered in the hospital. So there really isn't that much treatment that can be provided. It's more supportive.
Obviously, Dr. Wallis, the best thing to do is not to get it. So what is your advice as a medical professional, not just somebody on the internet, about how you should, how you protect yourself?
Yeah, I think the absolute most important things you can do, number one, is get your flu shot. That at least will help, protect you from the flu as it becomes more prevalent. But then really continue doing what we've been doing for the past year. Wash your hands, wear your mask when you're outside of your home, and social distance from people. Try not to go to big gatherings because that's really how this spreads around, both the flu and COVID-19.
All right, Dr. Wallis, Brent Wallis from People's Health. Thank you, sir, for that. 7:19
Thank you.
now.